Hello everyone. We are pleased to have with us today Eric van Woensel, a homeopath from Belgium, who is the moderator of the e-learning course for the International Academy of Classical Homeopathy and the co-author of the Levels of Health book with Professor George Vitulkas. Eric, welcome to homeopathy.com.
Thank you.
Eric, you were born in Belgium, you studied in Netherlands and Germany, and now you are associated with the International Academy of Classical Homeopathy. Tell us, how has your journey been into homeopathy through all these years? From studying in Netherlands, then studying in Germany, then studying with Professor Vitulkas. What has been the journey like?
What has been the journey like? Where shall I start? You want me to start before I studied, how I got to know homeopathy?
Yes.
Okay. I got to know homeopathy when I was 15 or 14 years old. I had the flu and we always took aspirin. You know the aspirin you put into water and then you get this mixture, which had a very bad bitter taste. So I was at the point that I could say to my mother, no, I don't want this.
Okay.
And then I went to a pharmacist in the village and I told him, I've got the flu, but I would like to have something which tastes better. And he gave me a homeopathic remedy, which was very extraordinary because homeopathy was forbidden by the law in Belgium. Even for pharmacists, it was forbidden to have homeopathic remedies in the pharmacy, but he had homeopathy. So he gave me the remedy and I took it, and the effect was, as we know, of homeopathic remedies, impressive. And the taste was very good. So then I got interested, and he had books at home. He had the Organon and several books, so he gave me the books and I started to read and learn, and I started to read more and more, and until the age came that I had to choose for a profession. And then evidently I chose for homeopathy because I was reading it for many years and I became very interested in it. So then I started practicing about 82, so the first homeopathic remedy I took was about in 77. So then in 82 I started doing cases, but I felt it would be better to have a diploma. So I went to a Dutch school to get a diploma, and then in 83 I saw George Vitulkas the first time in Amsterdam in a seminar, 83, 84. And then of course I got interested in his teachings, and he did a course in Germany starting 88, 89 in Celle.
Yes.
And this course I did. And this is basically my training. The studying from a young age, and then the refinement given by Professor Vitulkas in a way.
So was there a difference in the kind of education that you experienced in the Dutch School of Homeopathy and then coming all the way here to the academy and studying with Professor Vitulkas?
Well, of course, I mean, it's difficult to find the clarity of teaching you find with Professor Vitulkas. The clarity and the totality of the concept. You can find bits and pieces, but like somebody once said before Vitulkas, we were in the dark. Okay, he put light to a lot of things, and he put things also in a modern perspective, which is very important. If you read the Science of Homeopathy, you see how he uses the old texts of Hahnemann but put them in a modern frame, which is very important for the development of homeopathy and the acceptance. So this is the difference.
Was there something else that made you so committed to homeopathy? Experiencing just relief to you, or were there initial some magical cures that got you hooked to homeopathy?
No. There were no magical cures that got me hooked to homeopathy. I was intrigued by the logic and the scientific approach. I mean, in allopathy there's a lot of knowledge, but the treatment is the insight in the treatment is very low. And this I understood apparently from a young age on, because I didn't. For me, the approach of homeopathy, looking at health and disease, is a very how can I say? It's a very well-developed knowledge. It's an in-depth knowledge which you cannot find in any other therapy.
That's right. That's right. So when you started practicing homeopathy, and did you see a perceptible change in the way you practice and the results you were getting after you started studying with Professor Vitulkas?
Well, I was lucky to meet him. I started in '82 and I met him in '83.
Very early in your
So
career. Yes.
I read his small book, Medicine for the New Man.
Yes.
I read this when I was 18 or something.
That's very good.
So I knew his teachings from the beginning. So for me there was no big difference, because I could see the difference when I read other books and the approaches, but they were not my teachers.
Yes.
So I saw the difference, but the education I got from the beginning was actually in that direction.
I have seen a lot of Professor Vitulka's own students swaying away from some of his teachings and diverging towards some newer methods and philosophies and ideas. What has kept you within the core principles of classical homeopathy as taught by Professor Vitulkas, and what is your idea about the new thoughts and ideas being projected on homeopathy?
I think what kept me on the right track is that from the beginning I always went back to the original sources of the literature. So I went back to the writings of Hahnemann, also his articles, and I have always been interested in the development of homeopathy. And if you look at this development, there is no way you need to have other information. It is so logic and so practical. And for me, I never had the need to have another approach, because it helped me in every aspect. Every case, every difficulty I could solve by going back to Hahnemann, Bönninghausen, Lippe. They gave all the information, and then you have Kent and Vitulkas, and the circle is closed. So for me it was also, if you read how clearly Hahnemann explains the difference between the use of signatures, for instance, and homeopathy, why would you go back to this? Many new approaches are simply a regression to pre-homeopathic medicine, like signatures and all these things. I mean, Hahnemann clearly writes about it, about the use of minerals and all these things. So for me it was, there was no need. Still, I don't feel any need to look for other approaches.
And when did you graduate from being a student and a practitioner to being a teacher yourself?
I started teaching in 1990, if I remember well. Yes. In 1990 I started teaching at a school where I taught for about 9 years. Then I opened my own school and I started a postgraduate program and a supervision program. And this I did for maybe 15 years, I think, till I started doing the international teaching.
And you have been the moderator of the e-learning course for the academy also.
Yes.
What difference,
English speaking.
for English speaking, what difference do you perceive in live teaching and an e-learning course?
With modern technology we can do a lot, actually. I mean, in the e-learning there is a daily contact with the students, so they can ask questions and I reply. Actually, the advantage of doing it online in this way is that if I want to clarify something, I can take a book
Yes.
and refer to it. This I cannot do in the class. This is an advantage. Of course, many people like personal interaction, but I don't think it's necessary to transfer information, especially not with the modern technology, where you can have daily contact. The people here in the class, they can see me for 10 days or 8 days, while the people in the e-learning, they can see me daily for 2 years. I mean, they can ask me advice for 2 years daily, so it's a big difference.
And what is the feedback that you get from the people who have done e-learning course or are currently doing the e-learning course? What kind of feedback do you get from the students? How useful do they find it in practice? Are they able to put in practice what they are learning through the e-learning way? What kind of feedback is coming?
The feedback is mostly good. People are very enthusiastic about the material, and they are very enthusiastic about the fact that if they have any doubts, they can ask a question and immediately get a reply. The practical application, depending on the level of the pupil, they get support for this as well. So if they have problems, they can ask, and then I advise them what to do. So in this way also it's quite satisfactory, because they have direct contact with someone who has enough experience to guide them in the right direction. So in a general idea, people are very satisfied with this.
You are also the co-author of book Levels of Health with Professor Vitulkas. What is your experience about the concept of levels of health? How useful? It's a wonderful concept to understand the prognosis of the patient and managing the case that we have been seeing in the class also. After such a long experience with this concept, because you have been associated with right from the early stage, what are your thoughts about it now? How refined the concept is, how universal the concept is?
Through the years, using the ideas of the levels of health, every year I become more and more convinced that it is impossible to apply homeopathy correctly without this information. It is essential to be able to at least evaluate the case, but also it's essential for a prognosis before giving the remedy. So I think basically it should be information that every school teaches their pupils, because without it it's very difficult to have a successful treatment in the sense that you know what you're doing, guiding the patient towards a stable condition of health.
Are you teaching the teachers too?
Am I teaching the teachers too? In my classes are teachers, yes, but we don't have a separate group for teachers.
I think it's highly required, because if teachers are trained in the concepts, then they can teach many more students wherever they are.
We have been thinking about it, yes.
And you are, in a sense, really a global homeopath. Born in Belgium, studied in Netherlands, then studied in Germany, now studying in Alonissos, and probably giving seminars in another dozen countries.
Yes.
What is your observation about the general status of homeopathy in all the countries that you are associated with?
The level of homeopathy.
Level of homeopathy, the current situation of homeopathy in all these countries where you are teaching and or where you have taught or where you have studied, and what change you have observed in the past 15-20 years since you have been teaching homeopathy?
Well, to be honest, there has been a very weakening influence in homeopathy in the last, let's say, 10-15 years, because of so-called new ideas, which brought a whole host of confusion into the students of homeopathy. And this is what I basically see everywhere, that because of bad teaching there is a lot of confusion, and homeopaths need to study a lot, restudy, to correct this bad information, this misinformation. So this is what I basically see everywhere, that almost in every country where I come, which is all over the globe,
Yes.
there's a big need, a great need for correct information.
And what solution do you feel about this weakening? How do we correct this weakening?
The only solution is to make the information available and to make sure that everybody knows where it is and what it is, and to show the practical value of it.
I have heard that of late, in most countries, younger generation is not coming into homeopathy. In most seminars, still the old homeopaths are coming to attend the seminars, the new generation, the young people who are not taking it up as a profession. Do you see that in your seminars, in your courses also?
Yes, we see it in schools, I think, all over the world, that there are less students. I don't know in India, but I mean in Europe and America, less students going to homeopathic schools, also in England. And this is of course because there's a lot of negative information has been in the past years in the press, because for whatever reason we have had a lot of negative criticism. And this has given a wrong impression to the society, and therefore young people choose less for homeopathy, I think.
You are from Belgium, and then recently in Belgium they disallowed professional homeopaths from practicing, while the medical doctors can practice homeopathy. What do you feel about this issue? There is a huge hue and cry from the non-medical homeopaths, and it's real that some of the homeopaths are really good. Shouldn't homeopaths who are not medically qualified be allowed to practice? How do you feel about this whole issue?
Well, the history of homeopathy in Belgium is rather strange, because it was quite popular, and even there were several homeopathic hospitals up till 1908, 1912, when they suddenly implemented the law, closed everything, and it was completely forbidden, even for pharmacists to have it in the pharmacy. So a few years ago they allowed it, because there are other countries in the European Union that have homeopathy, and now they are turning it back only for medical doctors. What do I feel about it? Yes, of course it's a pity if well-trained, experienced homeopaths cannot do their job. But of course there is a task for homeopathy, for the homeopaths, to show what their value is. And then if you can show the value, you can convince what the need is for non-medical doctors, homeopaths, how do you call it?
Eric, you are one of the senior-most faculty of the International Academy of Classical Homeopathy. Is there a message that you would like to give to homeopathy students across the world, in which you can show them the right way to learn homeopathy and motivate them to stick to the core principles of homeopathy? Is there something that you would like to say?
What can I say? Homeopathy basically is quite simple. So it's a therapy based on natural laws, and nature always tries to keep simple. So my advice is to try to study the basics of homeopathy and try to stick to the simple basics, and then step by step try to gain more information which helps you to get insight in the different kinds of patients you have to treat, and to study materia medica from a practical point of view. So study the correct keynotes of the remedies so you can apply them at the correct moment, and try to always keep in mind the basic principles of homeopathy. The problem we have in homeopathy, it is the only science that allows everyone to publish under the name of the science homeopathy. I mean, you cannot publish a book on chemistry or mathematics just like that.
Yes.
So in homeopathy, the problem of the student is that the student himself has to find out whether the book he has in front of him has value or not. And this you can do by studying the basic principles, looking whether these are followed in the book, and then decide whether to read it or not. So homeopathy is based on the provings, for instance. If someone offers you a book in which there is materia medica described without a good proving, you should not read it, because it has no value. For instance, this is in...
Yes. That's a wonderful message, and I think that's the right way to study homeopathy. Stick to the core principles, stick to the basics, and then build upon them through good teachers and good books. Thank you so much, Eric, for being with us today. It has been a pleasure talking to you.
You're welcome. Thank you.